Okay. Should we make the yoga is going to be mandatory, right?
The yoga?
Yeah.
It's not mandatory.
I thought that's what we're going to do, make it mandatory. Because we're paying for it, right?
Well, yeah.
It's a mandatory event.
Okay.
Yeah.
Got it.
Right?
Because she was just asking me if she said that she understood that we'll invite everybody, like both businesses, like both BPS and Ivy, if they're scheduled or not. And I said, well, I only invited people who are working that day currently.
Okay.
So unless you want to do that.
Let's talk about it after this.
Yeah.
What's up, you guys? Dr. Barrett here. We are tuning in, and we're going to go live like we do every Wednesday. We're here, right here in Beverly Hills. So wherever you're at, you guys give me a shout out to see where you guys are at. I'm from Virginia originally. I'm going to adjust this so that I can see you guys a little bit better. Where are you guys tuning in from? Okay. So let's see. Okay, how painful is tummy tuck recovery? Well, you're in the right place. I do a lot of tummy tucks, and I do a lot of Exparel, a lot of numbing medicine in Ridgecrest, California. What's up? I do a lot of Georgia, okay, Bay Area. What's happening? Boise, Idaho. Hell yeah. Philippines? Roseanne, you go. Beverly Hills, Friday, right next door. Okay, Los Angeles, SoCal Bella. All right, so you're in the right place. Forget who's asking about why tummy tuck can actually be painful. It is a very big operation, and so if you take the time to make sure that you numb up all the medication appropriately, numb up the areas appropriately prior to doing your surgery, you don't have a whole lot of postoperative pain afterwards. And there's a lot of things you can do, including Exparel, which is a long-acting pain medication. Make sure your doctor gets Exparel and uses it. You won't even need pain medication afterwards, okay? Also take CBD, magnesium afterwards, that relaxes those muscles. So that's why if you go to postoprecovery.com, you can see my tummy tuck kit that I recommend for people. I'm not trying to plug it, but it's amazing how many doctors don't know about CBD, they don't know about magnesium, and how it can decrease your pain requirements, okay? San Francisco, Sylvia, what's up? All right, who else we got here? We got Rosalind from Beverly Hills. Okay, get back to work. Okay, so that's it, you guys. We're here in Beverly Hills. We're going to talk about mommy makeovers in general, okay? And not trying to go live together with somebody here, so I'm going to decline that. And then we're going to talk about plastic surgery healing myths, and then we're going to answer your guys' questions. So hang tight, all right? Some of the basics here. Mommy makeover. What is a mommy makeover? Okay, it's generally breast rejuvenation of some sort. So it's for moms or people that have lost a lot of weight. So if your breasts are saggy after breastfeeding, having kids, if you need a tummy tuck because your abdomen was stretched out and your muscles widened because rectus diastasis, that is a mommy makeover. It's a comment. You can keep that on, John. I like there. That is a combination of the breast and the tummy rejuvenation for moms to get your beach body back, right? And that's a really satisfying thing because it's not like we're trying to make you somebody else. I mean, we're just trying to get your body back. Sometimes we go a little bit bigger with the breasts when we do it, okay? Then there's also a procedure that we do in addition to that. I call it the Grand Slam Mommy Makeover, and that's when we take some of the fat that we do, the liposuction here, and transfer it to the buttocks. Okay, so you're good here, and you're good here. And a lot of times we want to do that because that fat that we take from liposuction is good fat and we want to keep it. But not everybody wants that. So that's why we most of the time do breast and tummy at the same time. So a lot of people ask about how do you qualify for a mommy makeover? Well, you got to be healthy. I don't want to jeopardize anybody's lives. A tummy tuck does put you at risk for blood clots, okay? Because it closes off your abdomen, and so we prescribe blood thinning medication. We have put leg squeezers on our patients. We have you walk right away. That's some of the things, and so we kind of look at your health. But if you want to know if you qualify, send in your information to our virtual consultation page at drdanielbarrett.com. Virtual consultation. Okay, send in your information there, and then we can actually just kind of see if like, okay, you need to lose some more weight. If you're 500 pounds, you're going to need to lose more weight. Okay. But we've done some people that are 300 pounds, right? And they're relatively healthy, okay? So it just all depends. So for those of you guys that are on TikTok, make sure you follow me on Instagram, drdanielbarrett.com. I'm sorry, Dr. Daniel Barrett is my Instagram handle. I actually have a surgery today. I did a breast surgery today. I actually did a mommy makeover this morning, but I didn't show it on social media, but I will be showing that. So I do live surgery so you can learn more. Also on my YouTube page, Dr. Barrett Plastic Surgery for YouTube. Okay. Recovery for my tummy tucks is 10 days, okay? A lot of people say, oh, I need to take a month or 6 weeks. You can if you want to take that. But most of my patients, they can go back to work around day 11. And the reason why is because all the rapid recovery techniques that we do. Now, I'm not going to say that's true for everybody. A lot of other places, it's 2 to 3 weeks. Because again, a lot of that, if you don't do a lot of that pre-numbing medicine, you're going to be sore and stuff like that, okay? How long is the whole process of getting Mommy Makeover? Well, if you came in my office today and you were healthy, we would need to get labs. Okay, so that takes a day, and then we can really just do your surgery the next day. Okay, and then you probably need, surgery takes 4 or 5 hours. Then we would need that good 10 days of recovery. But then you have a full 6 weeks of kind of relative recovery, like things are still kind of healing. It's not to say that you can't go back to work and stuff at the 10-day mark, but things are just kind of still relatively. 6 months for like incisions, like rock solid, and then a full year for a lot of the swelling to go down. So that's kind of the whole shebang for Mommy Makeover. All right, so I want to talk about some plastic surgery myths. One of the myths is it's only for women. It's not true. I get a lot of men in my practice. I just saw several men this week. We've done some tummy tucks and things like that. Lots of liposuction. For guys, you get those stubborn areas. Definitely do Botox and injectables. It's only for the rich and famous. Believe it or not, most of my patients are not rich and famous. They are just normal people like you and me. Who have something about their body that they want to fix, okay? It is a little expensive, you do have to save it up, but it's cheaper than a car for major operations. So, and it's your body that you're dealing with. So you got one life to live, might as well make it, make it count and be, happy about your body and take advantage of the many years that we have left. I think someone said, was it 10,000, how many days do we have left? 10,000 days, or something like that. So you decide how you want to live it. If you want to be covered up in your clothes all the time because of these stubborn areas, or you want to be out there being proud of your body, it's up to you. Will make me look fake. Will make me look fake is another myth, okay? Plastic surgery done right doesn't make people look fake. There's a lot of techniques that I do, especially with implants, to go partially underneath the muscle so you get more of a teardrop shape. If you look at my results on my website, drdanielbaird.com, before and after photos, you'll see that most of my stuff looks pretty natural, and that's my jam. All right, I want natural looking results so people can't tell that you had plastic surgery. Okay, and then got a couple more here. Recovery will take months and is painful. That is also a myth. We just talked about that. Even the Mommy Makeover, people are back to 10, 14 days depending on how much we do. Now, if we do circumferential body lift, that's a little more involved. That can take up to 3 weeks. Leaves massive scars, not if it's done right. That is another myth, okay? Plastic surgery done right, I close all my breasts in 5 layers. I do this taping technique. I do this scar gel management on top of that. And then we can do some CO2 laser afterwards. Most of my scars, they disappear with the appropriate treatment, okay? They fade away. Now, if you look really closely, you can probably see them. But if you're naked in a dimly lit room, no one's going to see them. That's the goal, right? And most of them can be hidden in the bikini line or wearing a bra when you're out in public in bright light, okay? Another myth is results are immediate or they won't last very long. That's not true. Most of all the surgical procedures we do last forever. Now, if you gain weight, that kind of thing, or if you get pregnant again, that's another story. Okay, then we might have to touch things up. Breast implants increase the risk of breast cancer and prevents breastfeeding. That's also a myth. It does have an impact on breastfeeding. It's about 7 to 10% of women report difficulty breastfeeding after implants. I like to think that my technique is better, but I don't have the statistics on that, so that's what you have to look at when you're thinking about getting some kind of breast surgery. But if you're not worried about breastfeeding afterwards, like a Mommy Makeover situation, then you don't really have to worry about that. The implants also don't cause cancer. There's textured implants that have a rare form of lymphoma associated with them. We don't use them anymore. But the regular smooth silicone implants are perfectly safe. I wouldn't hesitate to put them in my own body. I just don't know where I'd put it. My wife would think I'm weird. Okay, getting implants will weaken my immune system. Typically not. So now if you get an implant that, if it's not done correctly and you get a biofilm on it from contamination, that can weaken your immune system. Okay, that's why you have to get it done right. Don't try to bargain shop for implants. Go to the best. It's like 2 things you don't bargain shop for: parachutes and plastic surgery. Okay. And that's one of the reasons why. So that's what we contributes to capsular contracture, which is the #1 complication for breast augmentation, and breast implant illness, if you've heard of that, okay? So that they can get infected and they can cause problems for people, for their immune system. Botched plastic surgeries are common. I don't think that's a myth. I think they are common. I think a lot of doctors are focused on money, and they're not focused on the patient, or they're just not skilled, or they have no clue. And there's a lot of people out there that aren't even real doctors doing this kind of stuff. And so you've got to really do your research when it comes to your body. It's just like, if you're spending more time researching a restaurant than you are your plastic surgeon, you've got a problem, okay? So just like, do your research on a restaurant, you go get a nice experience. Do your research on a car place before you go get your car worked on, otherwise you're gonna get taken advantage of. It's the same thing for plastic surgery, except tenfold. I would do 10 times the amount of research that you are gonna do for those things, okay? Plastic surgery truths. We have a couple things. You should be overall healthy and have realistic expectations. That's great. That you want to kind of have a great conversation with your plastic surgeon about. He's like, hey doc, is this realistic or not? Okay, they should be able to tell you that or not. And I do that all the time. Like if you're 75 and you're expecting to look 21, it's just not going to happen. A couple other things, and then we're going to move on to your questions. Cosmetic versus plastic surgery. Okay, so if someone says they're a cosmetic surgeon, be careful, because it generally means they're not board certified. You want to look for board certified by the American Board of Plastic Surgery, and you can look that up online. Okay, cosmetic surgery board is a fake board, and it was developed for all the people that can't get board certified by the American Board of Plastic Surgery, which is the gold standard. Okay, it took many years off my life to get board certified. Unnecessarily, but most of it was pretty necessary to be a good plastic surgeon. So a couple things why what we do differently here. Why would you want to come here? We kind of do a holistic approach, have a lot of supplements. We optimize you prior to surgery, and then after surgery we try to minimize your downtime. And we're really nice. So everybody says they come in and just like, we make the whole experience very nice. We're not the cheapest, but I think you get the most quality from that. So, all right, I'm going to dive into your questions now, you guys. Let's get into it. Does CoolSculpting work? Yes, it does, but it does minimally, okay? It freezes the fat. They discovered it by people who used to go horseback riding, and the lateral part of their thighs would start to slim down. It was because it was cold on the outside, okay? So yeah, the cryolipolysis does work. You have to get a certain temperature, but it creates a lot of scar tissue, and sometimes can have complications. It can do the reverse. So sometimes you put on an applicator and the person can get growth of that fat. But for the majority of people, it reduces the fat in that area. I don't have one of the machines, but I do know that it does work, and I've seen it work, but it doesn't work to the extent that I am really satisfied. I'm a surgeon. I like to nip and tuck, and I can get better results with my hands, so that's why I like liposuction instead of CoolSculpting. But it does work in certain areas. Any advice for keloid scarring post-surgery? Keloid scarring is a hypertrophic scarring more than hypertrophic scarring, so it's generally a genetic thing. So brachioplasty, how do you do that surgery? I'm going to answer that because that's from you guys really quick, and then I'll get into keloids, because it's actually related to that. Brachioplasty generally is going to be a little scar here. We do it under general anesthesia, and we take out all the skin that's there. So you go from squirrel arms to regular arms, all right? Back to the scarring. Now, you could have a hypertrophic scar, which is like a thick scar, and then a keloid scar actually mushrooms out from that, okay? So it all starts from keeping you below the threshold of causing a very thick and hypertrophic scar. And that threshold, everybody's different. So we try to keep that under by my meticulous healing techniques, of suturing techniques and handling techniques during the surgery, and then also doing some occlusive dressings after the surgery and minimizing that little micro movements that you can get. And then scar gel management afterwards. And then also, if you've noticed, if you're pregnant and you get a C-section, your C-section scar tends to be kind of like that, kind of be thick. And that's because you have a lot of hormones raging in your body from pregnancy. Those cause an upregulation of scar tissue. So that's why I revise a lot of C-section scars later. It's not that the obstetrician did anything wrong. It's just there's so many hormones present during that time that you're not going to heal properly. All right, so we've got a couple other questions. Dead Sexy 007, why do you suck out the breast gland versus cut it out in a man boob surgery? That's kind of my specialized technique. So if you have male gynecomastia, I go in endoscopically with a little tube that has a little morcellator in it, and I kind of drill little holes in the glandular tissue. The reason why I do that is because it lays down flat, and it's a gentle takedown of the gland versus a big whack of the gland, okay? And I find that to be much more beneficial and satisfactory in terms of the final result versus the old school way where they make a big scar and then they scoop it out. Okay, so as I know, I think I'm the only one in Beverly Hills that's doing that right now. There's a guy in Dallas that does it as well. So if you have gynecomastia, come see me if you want to do something surgical about it. Okay, asked by Faith Holmes, do implants feel natural? I think so. They're silicone, and if you have natural breast tissue above them, they feel really natural. Okay, not as natural as a real breast though, but it gets pretty darn close. If you're curious, you can come by my office and you can feel one for yourself. All right. So let's see. J4263, why do some doctors wait 6 months after uplift if you want implants? You know, some people, they want to be very safe. So if you get implants, they want it to settle and then do the lift afterwards, okay? And that's just to be very safe because sometimes it's like trying to hit a moving target. I'm pretty good at it, so I do a combination of mastopexy and augmentation. So basically lift and augmentation at the same time. That way you can combine it into one surgery, and I get pretty good results with it. But not every surgeon likes to do that, and that's fine. It's definitely the safer way to go. Yes, we do sclerotherapy for veins, but not varicose veins. Varicose veins are bigger. That generally requires surgery. We handle the little spider veins. What was my GPA as an undergrad, Selm? 000? I think it was like a 3.3. It was pretty crappy. I never studied for anything, and I had to go to master's school to kind of really pull it together to get my act together to get into medical school. So I did 4 years of undergrad at James Madison University, and then I did okay in my SAT. I studied the night before, and then I went and I did a master's degree, and that's where I really turned it on, learned how to study and stuff like that. So, GPA is important, but I think your SAT and your MCAT scores are actually more important. So, and what should you research when looking for a plastic surgeon? Happy and Sassy asks, well, I think you should look for, I call it the research pyramid, okay? At the very bottom, are they a doctor? Okay. Are they a plastic surgeon? Are they board certified? Okay. You'd be surprised. A lot of people are not even a doctor, and they're doing it in the garage. They're not a plastic surgeon. They're dermatologists doing liposuction. So you want to make sure that those things are all there. And if they are a plastic surgeon, make sure that they're board certified. Okay. Boom, boom. Those are some solid requisites there. The next step would be check out their website. Do you like their results? If you don't, go somewhere else. If you like the results, great. Give their office a call. Check. Are they nice on the phone? If they're not nice on the phone, go somewhere else. You don't want us to go and have this big procedure with your body and someone's not nice to you on the phone, okay? The whole office has to be on board for you. Check their reviews online. Make sure that they're doing good surgeries and do the research online on their integrity and so forth like that. Make sure they have a medical license, everything like that. And then lastly, go meet with the doctor and make sure that you have a good bonding with them. You're on the same page. You want to make sure that, like, if you go in and you just want small breast implants, and they're like, no, you have to go D no matter what, like, okay, turn around, go out the door, all right? And then make sure it's a good fit there, right? Because again, you are trusting your body with this person, and because you're going to go to sleep and you're going to wake up and they're going to do something on you, and you got to make sure that they do the right thing. Don't we hate when dentists do Botox? I don't hate it. I think they're probably, if they're smart enough, they could probably figure it out, but that Botox is thankfully one of the safer things that people can mess up, and it's not the end of the world. All right, so I have another question here. This one is from Tilda May. Do you ever use twilight sleep in place of full anesthetic? I don't use twilight sleep generally because twilight is actually harder than general anesthesia to keep your airway open. In general anesthesia, we put a little pillow here to kind of keep the airway open, and then you're completely knocked out, you're sleeping, and then when we're done with the surgery, we wake you right back up, and we minimize the anesthesia as much as possible, okay? So that's why I like to do general anesthesia. A lot of places where they say they're doing twilight, they're actually not board certified. They're not using a surgery center because surgery centers don't allow non-board certified doctors in there, okay? So that's why. Just had your tummy tuck, awesome, congrats. And then, okay, so what are the best quality implants from Eloisa? They're all pretty good. 3 main companies, Sientra, Allergan, Mentor. Those are all really good quality that I'm aware of, okay? Let's see, we have some other questions over here.
Is there an age limit when it comes to mommy makeovers?
Is there an age limit? I don't really have an age limit. So if someone comes in who's 80 years old, wants a mommy makeover, and they're healthy, let's do it. But I think it's all relative. I mean, I remember in residency, we did surgeries on 90-year-olds, So age is all relative. Amy Mann, Dr. Barrett, my tummy tuck. Oh, thanks. Umbilical hernia repair can alter the recovery. Amy, yeah, so an umbilical hernia repair can just make it a little more sore, and you have to be just extra careful with lifting, okay? A lot of times people have hernias from pregnancy, and we can fix that hernia at the same time we do the tummy tuck and patient in the middle. And so you just got to be extra careful. Try to lose extra weight prior, because the less weight you have inside, the less risk of your hernia popping through your closure. Okay, so that's why a lot of doctors, they say, make sure you lose weight before hernia surgery, and it's for good reason, okay? Didn't realize you're from Virginia. Oh my God, Becky, that's right. I'm from Virginia. I grew up in Warrenton. I don't even know where that knows where that is. And I used to have to drive 45 miles to high school. It was Bishop O'Connell High School in Arlington. So I went from like a rural area, driving by farms and cows and stinky stuff, all the way to Arlington, which is just outside of DC. Great question. We have a scar kit on our site. Yep, cool. All right. Can you get rid of keloids, Benjamin? Yes, you can. You can get rid of keloids. You can cut them out, close them very precisely, inject them with Kenalog as they're healing, and then you can even do radiation if you need to on them. If you weren't a plastic surgeon, what would you be doing? I don't know. Probably be some kind of entrepreneur or some kind. I really genuinely love helping people. That's kind of what drives me every day. When my patients come in and they're really excited to see me, and they just tell me how I changed their life, that feels really good. I don't know if you get that in any other field. So I love doing that. I started the supplement line so I can actually help. It's not my supplements, believe it or not. It's just my recommendations. I started putting more information out there so I can help people who are undergoing surgery, because it's what I know the most about, to have them recover faster and feel better about their bodies, and kind of help normalize plastic surgery for the world. Because I think it's okay to get some minor work, major work done to feel better about your body. Does forehead Botox affect the shape of your eyebrows? It can. Right now I need my Botox, but you can see my eyebrows up and they change the shape. So yeah, it just depends on what Botox you're thinking. All right, advice is for nurses who want to work in plastic surgery. I would suggest to try to get into a surgery center of a plastic surgery office, and then see if they can teach you some aesthetic stuff if you want to get into Botox and other stuff. But most of the time, it's hard to take you in and train you as a nurse injector if you don't have any experience. Okay, so we got a few more questions. Any recommendations for what to eat post-mommy makeover? That's from Heather Parrish, 969. Yes, after mommy makeover, you just kind of want to eat what your normal diet is. I, in general, try to eat lower carbs and stuff like that, but you need a lot of calories. You need about 20% more calories to heal after a mommy makeover. So kind of do whatever you need to do. A lot of smoothies, protein, all those things, nutrients. I recommend a product called Heal Fast, which is a supplement. It's on my website, postoprecovery.com, which you guys can get, and that helps you heal even faster because it has a lot of vitamins and nutrients in it. And yeah, so how is the recovery after abdominal separation repair? TIOA. That's part of the tummy tuck typically. So what I just mentioned earlier, it's about 10 days. And again, it's not bad because if you inject that long-acting pain medication Exparel in there, it is great relief for 3 days. Okay, what is the path? The path I took? I went to college, master's in science, med school, and then I did a dual degree in med school once I was in. I did a master's in health administration and my MD. Then I did 6 years of plastic surgery residency right here in USC, and then came right into Beverly Hills. I opened my practice. My opinion on the BBL in the Dominican Republic is absolutely not. They don't have anywhere the same standards as they have in the United States. You're asleep, and they could be injecting fat into your vein because they have, who knows? They're not careful. So you are totally risking it. And guess what? If you have a complication there, you're screwed. You're just done. So I just don't get a BBL. If not, go to a reputable place, save your money, or just don't get one. It's not worth your life. People die going overseas all the time, and if you have a complication, who's going to help you, right? So say you get this amazing BBL result in the Dominican Republic, and then you come back and then you have an infection, and you're calling the doctor, are you going to get on a plane with an infection to go back to Dominican Republic? Probably not. So then you got to kind of go to a hospital, and then you don't have a doctor that's kind of managing your care. Okay, so that's a big deal. All right, one more question, you guys, and then we're going to get going here. How long after babies toward abdominal separation? Katie Russell. So that's rectus diastasis. I generally say about 3 months is a minimum, but ideally 6 months would be great to wait after you have your babies to undergo surgery. Remember, you got to hold the little ones them and lift them and all that other stuff, so you have to factor that in. So we have a product called Tush Baby. It's a little belt hip thing. It's also on postoprecovery.com that you can carry your little one on, and it doesn't put that stress on your core or on your chest if you got implants. All right, guys, so thanks for coming. We're going to go live again next week. If we didn't get your questions, how can we have them submit questions?
We're gonna do a story where they can submit on Instagram.
Okay, so we'll do a story. We're going to submit on our Instagram, Dr. Daniel Barrett. .com or Dr. Daniel Barrett on Instagram. So you can submit your questions and we'll get back to you guys. If not, tune in next Wednesday. We'll see you guys then. Thanks.